So good afternoon, everyone. It's really great honor to be part of this session start with Country C because I know a lot of big name here and have been following your study for a while. And for the current study, I'm going to present and share today is the impact of multiple chronic conditions on labor force participation among middle-aged and older migrant workers in China. And this is our ongoing research and working paper for the current version, it's not that rigorous economic estimation, but because we find this topic is super important and interesting, so we like to share some preliminary findings here and also any comments or feedbacks, I'll appreciate it. First of all, I will start with some background introduction and also briefly talk about our motivation for this research. So as some of you may know that as defined by WHO and existing studies, multimorbidity or shorted as MCC is coexistence of multiple chronic conditions within one person. And from the perspective of public health and population health, recent research focus on health status of older adults has been gradually shifting from only focusing on single diseases to multiple chronic conditions. So there are, of course, a lot of reasons behind. First of all, a lot of literatures in the public health field has documented that the prevalence of multimorbidity is currently very high and will continue increase. And among the Chinese populations, the prevalence of multimorbidity for middle age around 50 to 59 years old is about 34%, and for those elderly above 80 years old is about 57%. And also in recent years, multimorbidity has been increasingly common in low and middle income countries. This situation also added the existing burden of infectious diseases, maternal and child health problems, or nutrition conditions. And certainly, multimorbidity has been associated with high mortality, reducing function, and also poor quality of life. So as we can see from this figure, this is an evidence from existing study in China show a pattern of prevalence of multimorbidity and also source of healthcare. We can see that for the patients with secondary or tertiary healthcare in the yellow line and primary care in the blue line, both healthcare settings had a relatively higher prevalence of multimorbidity, particularly after 45 years old. So this gives us a motivation to examine those multimorbidity burden on middle-aged or older adults. Beyond the literature from public health, actually the studies of multimorbidity in economic and social policy field still leaves a gap here. Firstly, multimorbidity may complex the labor market behavior or their job-seeking decisions, given that studies has shown that acute diseases or single chronic conditions may potentially reduce their labor participation or productivity. And also on top of that, the more complex conditions to coordinate may potentially trade off their leisure times in taking their care in the long term versus continue working at the labor market. And secondly, it's also important for focus on pre-retirement populations because the workers extended their working life, and that means the potential proportion of multimorbidity among middle-aged and older workers is also an inevitable trend. And thirdly, multimorbidity increase the complex of care coordination in care in both healthcare and social care. Then why we particularly like to focus on middle-aged and older migrant workers in China? So some studies from developed countries have shown that some adverse early childhood living environment or low socioeconomic status are associated with greater probability of multimorbidity, which may potentially affect their labor productivity or quality of life at a later age stage. However, this relatively limited research exploring the impact of multimorbidity among social vulnerable groups, such as those rural to urban migrant workers in low and middle income countries. So actually in China, by 2022, the migrant workers proportion accounts for about 20% of total populations. So as the important capital, human capital in economic development and also urbanization, migrant workers have played a super important role in the society in terms of the poverty reduction and bridging the rural-urban economic gaps. However, actually, they face pretty much challenges in maintaining their healthy aging arising from the inadequate social policies or lack of medical insurance and also limited health access. So therefore, we like to further explore how those kind of multiple chronic conditions affect their labor or job market performance. So specifically, the research question we'd like to focus in this empirical analysis. Firstly, we'd like to explore what is the impact of multimorbidity on labor force participation among middle-aged and older workers in China. And secondly, we'd like to explore if the effects of multimorbidity on labor force participation differ between the middle-aged and older adults, older workers for those rural to urban migrant workers versus those non-migrant workers. And in terms of the data, some of you may pretty familiar, that is the China Health and Retirement Longitudinal Study. And this study is a national representative sample of non-institutionalized Chinese older adults, middle-aged and older adults above 45 years old. And for our study sample, we include the participant from 2011 to 2015, age at or above 45 years old. And we define migrant workers by their birthplace referred to 户口 in Chinese, and their current residence that include workers with rural 户口 and urban residence. And our final study observations was around 43,000 person years. Well, for the key measurements of this study and for the outcome variable, we primarily use both extensive margin of labor measured by an indicator whether to work or not, and then intensive margin of labor measured by the non-zero annual working hours. And for the independent variable, we categorize those participants by their chronic condition types, including healthy, non-CHC, and one chronic condition and comorbidity. And the type of chronic conditions in our data set include high blood pressure, diabetes, cancer, lung diseases, heart problem, mental health, and relatively comprehensive diseases type. And for the current version, we use a two-part fixed effect model to do the estimation. And for the result, I firstly show some descriptive analysis from our population. So as we can see in this figure, among workers above 45 years old, the prevalence of MCC actually is pretty high. It's around 45% had 46% had multimorbidity, that is marked as the green part. And also for the summary statistic of the estimation sample, we found that their annual work hours are around 1,000, and that is around 126 days yearly. And we divided the population into three subgroups, including the rural 户口 rural residents and rural 户口 urban residents, which are the migrant workers, and rural 户口 urban residents. So we found that around 20% of the observations are migrant workers. Actually, this also consistent with the previous literature. And on average, we find that the migrant workers' annual working hours are relatively higher than the other two groups. And moving to this slides, I'd like to present some regression results. And the first outcome is the probability of whether to work with chronic conditions by Hukou and residents. So overall, workers with multimorbidities presented a decrease in the probability of working than those without chronic conditions. And in the second column, we find that migrant workers with multimorbidity had a reduction in the probability of attending work by about 6.7 percentage points. But there is no statistical difference reduction in the probability of attending work for those non-migrant workers. So including those born in rural and living in rural, and those born in urban and living in urban. So the effects actually more pronounced among the rural to urban migrant workers than those non-migrant counterpart. And then in terms of the next outcome, we examined the relationship between multimorbidity and their annual work hours. And we found that the reduction magnitude is much higher among migrant workers by about 21% decrease in annual work hours in the surveyed year. And among those non-migrant workers, even though there is no statistically decrease in the probability of attending work, but among those with work, their annual work hours also reduced by about 14% and 20% respectively for those rural and urban non-migrant workers. So we can find that the magnitude in reduction is not as high as migrant workers. And we take a further step to examine whether gender difference may affect their labor participation. And indeed, for female workers with multimorbidity, which are on the right hand of this figure, and have a relatively higher reduction in labor or working hours if they suffered from multimorbidity. So from the regression result, it's about 32% lower annual work hours than male with multimorbidity. So as a discussion and conclusion, our analysis provided a relationship or evidence between multiple chronic conditions and labor participation among middle-aged and older workers in China. This trend actually underscores the universal challenges posed by multimorbidity in the aging society, that's particularly more pronounced among migrant workers, which also highlights that the intersection of health and socioeconomic vulnerabilities. And these findings may provide some evidence from the China's case to other low and middle income countries with large population of aging migrant workforce. And furthermore, our study also reviewed the gender disparity within the demographic factors. And this kind of disparity may call targeted intervention that may address the special attention in terms of their labor market performance. And of course, this is a relatively early stage of this study and also have some limitations because the questionnaire are mainly based on self-reported, so this may potentially lead to some reported bias in terms of their diseases and also their working hours. And also for the current version, we'll only use the categorical variable by different diseases, but we cannot measure the severity or the combination of different chronic conditions. And thirdly, the current time range is harmonized data from 2011 to 2015. So when the new round of 2018 data comes, we can include that in our future study. And firstly, For this estimation, we mainly use the fixed effect. However, we think it could potentially use more like a causal inference design. For example, the study cannot address the potential reverse causality between labor participation and also the multimorbidity health status. So we may think about a better instrument or policy change to estimate how chronic conditions affect their labor force participation. And lastly, as a conclusion, and as I just talked about in the introduction part, that China is facing a challenge of rapid aging, and which could magnify the kind of multimorbidity epics. And because the kind of rapid urbanization continues for decades, actually the health consequences of these trends are also important for China's migrant populations. And by with this kind of situation also poses challenges to the current existing health systems, particularly when there is less coordination for those migrant workers with their health insurance, which based on their hometown, if they work in urban area, how could enhance their access to primary care and also diseases management, which could be a potential policy challenge and also important strategy to cope with the current situation. And also, it's important for employers and other stakeholders could engage into more working environmental friendly environment and social welfare for the migrant workers. And particular, we'd like to figure more about how gender or vulnerable factors may affect this pattern of labor participation. So basically, that concludes my presentation today, and I appreciate the Carolina Population Center for Doctoral Training, and thanks so much for your listening.